Hello, I'm Ronnie Eldridge, and welcome to Keeping Relevant. See, Virginia Fields. I have to say, Virginia, I have to interrupt, that I just learned your name is Clara, and I love it. But anyway, C. Virginia Fields leads the National Black Leadership Commission on Health to reduce disparities and achieve health equity for Black and brown communities. Meaning, as they say, they work to put the healing back in Black health. She's also a former borough president of Manhattan and a member of the New York City Council, where we met in 1989, and I'm so happy to welcome you to the program. Thank you.
Thank you.
So tell us a little bit, or a lot about Black health, what it means. Is there such a disparity?
Oh, absolutely, Ronnie. First of all, let me thank you, and I enjoy the times when I get to watch the show and seeing how you're keeping relevant and informing us in so many ways. Yeah, as the president and CEO of Black Health, formerly this organization was called the National Black Leadership Commission on AIDS. Back in 2017, for 2 years through 2019, we went through a rebranding where we wanted the name to more accurately reflect the work that we do. It was no longer just AIDS. We recognized that the intersectionality between AIDS and other diseases that disproportionately impact Black folks especially was major. So we expanded our focus areas to not just include HIV, but keeping HIV, hepatitis C, cardiovascular, prostate cancer, breast cancer, mental health, sickle cell, and diabetes. And those are the 8 areas based on data that disproportionately impact Black folks. And the disparities are great. I mean, even today, when we look at the maternity-related deaths, Black women are dying more from maternal-related deaths than any other group of women. And many of the causal factors related to these deaths include some of those 8 areas that we talk about. So through our organization, it is about education, advocacy, and policy. And on a national level, we do that through partnerships with faith-based organizations, community leaders, and others to create this awareness and try to change some policies in order to bring about some wholeness, or at least prevent disease and create equity.
And does it also cross class? Is it mostly poor people?
Oh no, it crosses class, because some of the deaths that we experience, especially around mortality, maternal. These are women who have resources. It's attitude, that they're not believed, that they are having problems. I think it was Serena, who had a major issue, but because she had advocates in herself and she was not willing to just accept that nothing was wrong with her. So, that's a classic example. So it's across all economic levels. That is exactly what the data shows.
Mm-hmm. Isn't that amazing?
It's sad. And it's racism. I come at it from a standpoint of just pure race. Yeah. Blacks are not given the treatments or believed that they are as sick as other, groups and races of people.
Isn't that amazing? You've made such a transition from public official, from being an elected official into, you were trained as a social worker, but it's that interest in people and their well-being that's really propelled you. Did you really learn all this from Dr. King when you were a young person growing up in Birmingham?
Yeah, growing up in Birmingham and my experiences there, no question about it, helped to shape my life, becoming a social worker, a community activist, as a member of the community board when I first moved to Harlem, as an elected official, and now as an executive of a nonprofit. I learned the importance of getting involved and staying involved. I mean, even before I was old enough to vote, my mother, I guess she would have been called a community social activist at that time,
yeah.
because she went through the community distributing literature about voting and all of that. So that's the environment in which I grew up. And one of the foot soldiers who marched with Dr. King as a teenager and spent 6 days in prison, all of that helped to shape my views. So as a social worker, working in family and child services at the Children's Aid Society, and then with the National Board of the YWCA, and many people don't know, their mission was to eliminate racism by any means necessary. That was the mission of the National Board of the YWCA, with people like Dorothy Hyatt as mentors and so forth. So coming up through that, and then in the city council, where, as you said, we served for at least, 8 years, and all of what we had to go through then.
Yeah. You know, I came from a family that was very active and interested in, and I was picketing and doing everything when I was in high school, basically. And we both grew up with an understanding, what do you call it, empathy for people. We wanted to see things better. I don't think we necessarily see that these days. Why aren't more people interested in a community? Why are we so motivated by selfish interests? What's happening in this world?
And I think especially, I often think about, it's theoretical, but it's true in the School of Social Work. We learned it in, of course, others fields, and that is Maslow's theory of hierarchy needs. And until people's needs are met at the very basic level, food, shelter, housing, and the majority of people in our communities that we need and want to get involved, those needs are not being met. Those people, the homeless population, to go through cities right here in New York, and to see people sleeping on the street like this. I go to a health spa on 55th Street, and when I get to do that, there's always this guy. It's a permanent location where he sleeps, and all of his belongings are there. You never see him, but you see him under the covers. Now, that is his permanent location. So needs are not being met, Ronnie, at that level. The other level, people are not voting because they don't feel that when we even vote, things are changed and made a difference. And I think all of that comes into play in terms of what we're seeing.
And when did it all start? Did it start with Reagan?
Oh, wow, now you're taking me. I don't know exactly when it started. He certainly had a lot to do with it.
Yeah, I just don't know. But nowadays, with the current politics, with the Trump campaign and the rhetoric, what do we do?
Well, first of all, I think we still have to keep our voices out there and be relevant. I think far too many of us are silent. And there's something that all of us can do, like what you're doing with this show on a weekly basis, bringing the issues forward.
Yeah.
And I remember Dr. King always said, there's something that all of us can do. We may not be able to go to the White House and sit and meet with the president or stand up and use our voices in such a magnetic way that he was able to, that influence people. But if you live on your street and your garbage is not being picked up, you need to complain. You need to hold those who are accountable for resources, for addressing the issues that impact our lives, and we don't do that anymore.
And we've been doing it. We're regressing.
Yes.
You and I worked hard for the Civilian Review Board, Complaint Review Board.
I remember when we went to Philly, right?
Yes, it was all, we worked so hard on that. And look what's happened. What happens with people? And my feeling is, and we were talking about this before, there's so many things that it's hard to keep, what we want to do. But the city council, for instance, let's talk about the term limits and what happened. And it's happening now with the colleges and the diversity movements and the anti-diversity movements and the Supreme Court and the whole conflicting theories. I mean, I'm sounding like I am. I'm totally confused.
No, you're not. You understand perfectly, and you see it because you've been a leader on so much of it and still much involved. So, okay, let's just take the city council, for example. Term limited, I think, started at the end of our term, the first time.
Yeah.
And what I've noted is with term limits, members coming in seemingly are not taking the time to learn, to grow, and to invest. And this is not all of them, but too many of them. But beginning to look at where do they move next. Okay, I know I've got 4 years. I've got 8 years now. What's the next step? What lobbying firm can I go to? What office can I run for? And investing more time there than the issues. Yes, we worked hard on the CCRB. Went to Philadelphia to see how they were implementing that program. And we also worked with advocates like, what was her name? Judy Westler. Mm-hmm. I don't know anybody who knew more about health than she did. And we took a lot of that information because we didn't have enough staff to do the kind of research. But we worked with them and was able to use their voices to help us push for policies and budgets. And I don't see that as much.
Well, you know, I think what it is they pick, in a way, well, term limits is so interesting also because it was decided by a businessman, Ron Lauder, and he, for some reason, decided he's going to term limit the members of the city council. I don't know if somebody was giving him a hard time.
I don't remember why he hit that.
He paid for the campaign. Mm-hmm. And as a result, you've got you serve 2 terms. I mean, it's, broken up and everything,
right.
But 2 terms. So in a way, it becomes the stepping stone, as you said, to the next job. It becomes your profession. And it doesn't become, like you've done it, going from one thing to another with the basic framework of worrying about the welfare of people. The back and forth from different businesses. And it's lost, well, first of all, 8 years is not enough time to be in the city council. It doesn't have any personality, does it?
No, I think at least 12, if you're going to do it, at least that.
And stagger it.
Yeah.
And not have everybody leave at 35 people leave at one time.
At one time. And it has really impacted the way we see budgets and policies getting decided. And we see people who do have that kind of experiences, like Gail, who went back in after a city council member, after Gail Brewer, I'm sorry, right? And went back to Borough president. So that person, she knows government. Right. There is no question about it. But you also have the interruption, say, like when the census is, it's a 2-year cycle. You have another election. So you get elected 2 more years, and then you can get elected for that full term or for 6 years to that 8th year. So it's very, I think, has impacted the results that we're seeing. And we see people running for the next office, whether it's state, federal, or whatever, but we don't see that passion for service as I think we experienced when we were working with people like Una Clark, like Annette Robinson, and who are still very active in their own communities.
The Supreme Court struck down affirmative action.
Yes.
And that was always what we wanted, right? I mean, we came out of the civil rights movement. We were going to equally share. People were going to be treated equally.
And certainly that doors of opportunities for blacks and other people of color were going to be open. And yes, affirmative action made it possible for many of us to step through doors that we would not have been able to step through, even though we were as qualified and could do the work and could do the education. Did it help many of us? Absolutely. But to close that door, I think, especially, at the college levels, I'm glad to see some universities are talking about changing how they, approach this and still keep the doors open and wide for people of color.
But then we have to look at the other part of it, is of the immigration and the growing, at that time, the growing Asian population. And the fact that they felt that they were being denied place in the hierarchy because of affirmative action.
And I was very pleased, even when that was knocked down at the courts, to see so many Asian groups out there fighting to keep affirmative action. Yeah, we have the people, the groups,
right,
who were felt being left out. But I saw equal number of groups of Asians saying it is wrong to knock it down because it opened up the doors even for Asians and other people of color.
Yeah. So now we have this anti-DEA, diversity, equity,
inclusion, DEI, right? Mm-hmm.
And it's, what is it, I don't know who's leading it. Who is leading it?
It's interesting you raised that question, because what we've been tracking, even in my work, many corporations committed to DEI during the height of COVID, that they are committed to creating more opportunities through diversity, creating equity and inclusion. Since that time, we have seen many of the commitments that were made during the height of COVID not being met. We're also seeing now corporations firing, or I shouldn't necessarily say fire, some of them probably are firing, but eliminating that department or that division. Ultimately, for me, it's about racism. It is about the growing population of blacks and Latinos who are moving into many of these spaces. And if you don't have the laws and you don't have the policies, it's easier to deny the opportunities. So I think we have to keep our voices heard and hold these groups accountable, especially corporations. When we look at boards, when we look at people in the C-suites, they're not people of color. And, I come at it, from...
When you look in the health field, are we having more and more people of color becoming the professionals and running some of these organizations?
We are seeing a growth there. We still have a lot of room to grow. Because one of the things, say for example, in the whole AIDS movement under President Obama, the National HIV/AIDS Strategy was passed. The first time the United States ever had a national AIDS strategy, even though we compelled other countries to have a strategy before giving them money. So under his leadership, it was passed. And one of the biggest hurdles was where the dollar should go in communities of greatest need. And one of the things that came to light too, these organizations were in the communities but not led by people of color, or they were outside of the community and sending staff into Black and Latino communities to provide service but not led by the people who were most affected. So that's an ongoing issue. We're seeing some changes there, but I think we're probably seeing that in other areas outside of HIV.
But we've also seen an explosion in the membership into Obamacare.
Yes.
That's made a big difference?
Without the Affordable Care Act, Obamacare, we definitely will not see as many people who are as enrolled. We still have a lot of work to do there. I mean, because you still have states like Alabama, like Georgia.
I was going to say, as long as states are responsible for Medicaid.
Right.
So,
and it would give them more money in their states. And as a result, it affects the number of people who would have access to care. It's crazy.
But are they interested in even doing that?
Who, the states?
The states.
No. No, they're not interested in doing that.
So we come back to politics.
Come back to politics.
That we have to change the state legislatures.
Start there. And I don't think people have given as much attention to state legislators as I think they are now. When
definitely.
they see things like redistricting,
Right.
when they see things like reproductive rights. Look at what happened in Texas.
Yeah.
The woman had to leave her own state, and it was her health issue. Ronnie, keeping relevant. That's right.
So are you going to eventually return back to that kind of politics?
Never to run for politics, for office again.
Right.
As I tell people, I wouldn't run for nothing. But I do and hope to stay involved in raising issues and holding elected leaders accountable. We elect people and we let them go off to their whatever it is that they want to do. And I want to keep doing that. One of the reasons I became president of this organization is that after elected life, I took about 2 years off and wasn't really sure what I wanted to do. And it kept coming to me, well, you know, social work is your field. So the person who was heading the organization was stepping down because she was moving, Deborah Fraser House was moving to the private sector, and Reverend Dr. Calvin Otis Butts was the chair of the board, and Dr. Prim. And I said, well, you know, other than supporting projects and funding, I don't know much about HIV and AIDS. And they kept talking, and I started reading, and it was very surprising to me that black women had the highest rates of black heterosexual women, have the highest rates of HIV/AIDS, and again, and it's still true today. And I said, well, we've been in this, we've been funding this, and I'm a part of civic groups, sororities, and so why don't I know this? So the education part really became important for me.
Yeah. It's why are we not, the other part of our political life, why are we not doing more to develop political interest in potential leaders?
Right.
Is it that campaigning is so hard?
Money, you know, it's always a big issue. And I think that certainly when I went to school, I'm certain with you too, civic classes, you knew about government.
Oh, definitely.
You knew how government, you knew how the Congress, the House, the representatives, the Senate, and the president, and the courts, and so forth. You had a sense of that, and there was an interest. But they don't even do that in schools anymore, which I think at least could be the
so agree with you.
groundwork.
I had my 7th grade civics teacher at our first meeting of the city council when we were elected. I mean, I can't begin to tell you how responsible I think he was for nurturing what was there. Yeah. So we need so much.
We do.
Now, what about the president? Tell me what you think.
Our current president? I would say if our current president runs and he, you know, has the campaign, I will support him. I think Joe Biden has done much more than what he gets credit for. When they talk about the infrastructure, I always say they should break it down, talk about bridges, talk about roads, talk about how your city can be improved through that.
And the jobs.
And the jobs. And recently, too, with more students being forgiven for those loans, and that is very important. And how he has fought to make sure that the affordable care has not been, you know, eliminated. And now he's talking about saving a democracy, because if Donald Trump gets back in there, Donald Trump has told all of us what he's going to do. Autocracy versus democracy. So I think Joe Biden has had a really, really challenged time when we've had all of these court actions going on and all of the mega people deciding that the election was stolen and sort of detracting from the work that still needs to be done. So if he runs, I'm going to support him. And I will encourage people who willing to listen to my voice.
But he is running.
He is running, so I'm supporting him. I'm supporting him.
Me too. And the other thing is, though, if he didn't run, who would run? And that's what we need to correct, I think, too. We need to encourage
We need more
people
succession
to get
plan.
back into the political thing who really believe in something.
And I think that is so important, Ronnie. And how do we do that?
Yeah.
I think we start at the local level, certainly in our schools. It's very basic, but you at least move up to that. And we use our community groups, too, to do more education awareness about the process. People think only sometime of voting for the president, but your state legislators, as we have seen over the past year anyway, are making a lot of problems.
Well, I hope that more people are like you. And really, I admire your career path and your effort in life. And I hope you continue, if you ever change your profession. It's not even changing a profession because that's the core of you. And so keep on doing it. It's been a pleasure, Virginia Fields.
Thank you,
Clara.
and it's such great. That was an aunt. I was named after an aunt.
It's a pretty name. I like
It really is.
Now that you're older. You like it.
I like it.
All right. Thank you very much.
Thank you.